E-test or Epsilometer test. The E-test, also known as the Epsilometer test, is a quantitative method used in microbiology for antimicrobial susceptibility testing. Its primary purpose is to calculate the minimum inhibitory concentration, which is the lowest concentration of an antimicrobial agent that will inhibit the visible growth of a specific microorganism. It is unique because it combines the principles of both the dilution and diffusion methods of antibiotic testing. E-test or epsilometer test is also known as epsilometer test, is a quantitative method used in microbiology for antimicrobial susceptibility testing. Its the primary purpose is to calculate minimum inhibitory concentration, which is the lowest concentration of an antimicrobial agent that will inhibit the visible growth of a specific microorganism. It is unique because it combines the principles of both dilution and diffusion methods of antibiotic testing. How the e-test works? Structure. The e-test is a modification of the standard disk diffusion test. Instead of using circular paper disc, it utilizes a specialized strip impregnated with a gradient of different concentrations of a specific antimicrobial drug. Each strip is labeled with a numerical scale that corresponds to MIC values, with the lowest drug concentration located towards the center of the plate. Procedure. An agar medium is uniformly inoculated with the test organism. Then the multiple strips, each containing a different antibiotic, are placed on the surface of agar so that they extend radially outward from the center. Reading the result and applications. Reading the result. The plate is incubated for 24 to 48 hours as the drug diffuses into the agar, as an elliptical zone of inhibition appear where the bacteria were successfully prevented from growing. The MIC is usually determined by looking at the strip's numerical scale and reading the exact number at the point where the elliptical edge of the bacterial growth intersects the strip. Applications. The e-test is an effective tool for finding the specific MIC of antibiotics against a wide variety of bacterial strains, and it has specifically been adapted and applied for testing the drug susceptibility of Mycobacterium tuberculosis.